Welcome back to Inside Personal Growth. This is Greg Voice and the host of Inside Personal Growth. And joining us from La Jolla, just right down the street, is Dr. Ran Anbar. And he has a book that I'm particularly interested in because I actually have hypnosis performed on me. Although he does hypnosis on children to cure ailments. Good morning to you. How are you?
I'm great. Good morning to you.
Well, this book, Changing Children's Lives with Hypnosis, A Journey to the Center, really is, it's packed full of stories, great stories that are great examples for our listeners to understand really what it is that you do, how you do it, and how you've helped so many families with children overcome everything from pulmonary challenges to anxiety to all kinds of things. But I'm going to let our listeners know a little bit about you. Dr. Anbar, MD, FAAP, is board certified in both pediatric pulmonology and general pediatrics, offering hypnosis and counseling services at Centerpoint Medicine in La Jolla, California, and Syracuse, New York. Dr. Anbar also is a fellow and approved consultant of the American Society of Clinical Hypnosis. He is a leader in clinical hypnosis and in 20 years of experience has allowed him to successfully treat over 5,000 children. He also serves as the professor of pediatrics and medicine and director of pediatric pulmonology at Upstate Medical University, SUNY, is it SUNY, University in Syracuse, New York, for 21 years. Well, it's a great bio, but more importantly for my listeners, if you want to learn more, go to Center, CENTER, Point, POINT, Medicine, MEDICINE.com. There you can learn more about Dr. Anbar. You can learn more about the book. You can also learn more about the services that he provides. And that's what we're going to talk about. It's not just the services, but really just the power of hypnosis today. If you would, please tell a little bit about your story as a pediatric pulmonology treating children with pulmonary disorders and your reason for embracing hypnosis as a method of treating children with pulmonary disorders and other diseases, because it's not a normal transition for a regular MD to say, okay, I'm going to embrace hypnosis. We were talking about Steve Berman, the gentleman that I go to that's right here in Del Mar. But I'm just curious as to the listeners would want to know, how did you get over there? How'd you make that jump?
Well, 25 years ago, I was practicing pulmonology when a young man was referred to me. He had very bad allergies to milk products. And twice in his life, he almost died from eating a milk product. And I was seeing him for his asthma. And he came in one day and he says, lately when I've been smelling cheeseburgers, I've been developing asthma attacks. I thought it was a strange sounding symptom. And I wondered if the milk molecule could be wafting through the air and affecting him, which it can't do, by the way. And I asked him, well, can you imagine eating a cheeseburger, which is something he could not do in real life? And within seconds, he was having a lot of trouble breathing. And I thought to myself, oh no, he's going to have a terrible attack. And I said, stop it. So he did. I said, whoa, what just happened here? Can you imagine yourself into an illness? And then the immediate corollary question is, can you imagine yourself out of an illness? Later, I found out what was going on was hypnosis. And that was my dramatic introduction to the field.
Well, that's quite a dramatic introduction. And you never know exactly why certain things are brought to you, right? And if you are curious enough, you go down the path. Your life changed as a result of meeting a very special children, Harry and Paul. You refer to them in the books. Can you tell the story and the impact that these children had on your career? Because there were two of them. And I think the listener would like to know the story and the impact.
Sure. Well, Harry came first. Harry I met when I was 16 years old. I was volunteering at the Children's Hospital at Stanford, and he was 12. He had a disease called cystic fibrosis, which in those days was it's still a lethal disease. And in those days, the average patient lived to be in the late teens. It's a lung disease that causes a lot of mucus that damages the lungs. And because of Harry, I ended up going into medicine and becoming a pulmonologist. I wanted to find a cure for cystic fibrosis. He was an early guide for me. Paul is a young man with a cheeseburger allergy.
Okay.
And, he asked me, well, I wanted to send him, when I recognized he was doing hypnosis, I wanted to send him to a psychologist who would teach him hypnosis, figuring if he could learn how to control his mind, it might help his health. He didn't want to go see a psychologist. He said, I'd rather work with you. And I said, that's nice, but I don't know anything about it. And he said, I don't care, teenager. So I went to my friend, Dr. David Keith, who was a psychiatrist upstate, and asked if he could back me up. And he said he would. And that's when I started learning about hypnosis. I read a lot about it, and I practiced with Paul for a good year. And a lot of the things I talk about in the book started off with Paul. I should tell you that Paul tragically died a year later as a result of exposure to a milk product. And after his death, I went to his family's home and I spoke with his parents. And I told them that Paul's work will be my work. Paul wanted to be a pharmacist and help people. And my work with hypnosis is a testimony to Paul. And the book is dedicated to him.
Well, again, you've had these crossings in your life and people that have come into your life, which, Joseph Campbell's story about, you go out and you journey, and the journey basically takes you and you find somebody and there's a career change path or something happens, and you get help along the way. And in your case, you got a lot of help. And, my best friend's daughter-in-law, you were speaking of Stanford and cystic fibrosis, had cystic fibrosis, still does. But Stanford did a double lung and heart transplant on her. And I ran a campaign to help raise some money to help the family. And I didn't know that even was something that anyone could do. And she today is still alive and running triathlons and doing everything pretty normal, and had a baby and a child. And it's a phenomenal story. Although the symptoms now are coming back again. It's starting to slowly creep back in. So, CF is a tough disease to fight. And as you said, life expectancy is shorter than normal. But, to actually get a double lung and heart transplant at Stanford, wow, I just was blown away.
Well, to update your listeners, in the last 30 years, in the major part of my medical career, cystic fibrosis therapy has advanced a great deal. There are now drugs that are almost curative. And
Really?
So the average person these days lives into their late 40s.
Yeah.
And children who are born with that now could have a normal life expectancy because of the advances in the field. So I don't want to leave a misimpression from the early 70s. And now in 2020s, we're doing much, much better in treating that disease.
Well, you're saying that they can get these drugs and take them for a lifetime. And the reality is, if they start them early enough, it can extend their life expectancy quite a bit, or maybe even normal, right?
Correct.
Yeah. It is really a testament to our medical community and the drug companies and everybody who are doing this intensive research. We live in unprecedented times that way. And I want to state that because I have a son who has chronic myelogenous leukemia and started on Gleevec. And if it hadn't been for Gleevec, now Sprycel, and he's now had it 22 years and has lived with leukemia for 22 years with those drugs. So pretty interesting what these drugs are now doing to treat these chronic conditions. Yep.
Since we're talking about this, I want to also acknowledge the Cystic Fibrosis Foundation that spearheaded a lot of this research, and the CF community. All these patients, thousands of patients, participated in drug trials to bring the current drugs to market. So it really was a team effort.
Yeah, it always is. And there has to be people willing to be part of that, those trial drugs. And you mentioned that hypnosis is nearly as old as the history of civilization. You say part of the global spiritual and healing traditions dating back to ancient Egypt, Persia, China, India, and Rome. Can you explain why hypnosis is so effective at tapping into the subconscious, allowing us to reprogram our thoughts?
Well, what hypnosis can do many things. One of the things you could do with it is to park your conscious mind in a calm activity. And by so parking, the subconscious is better able to express itself. And the subconscious can express itself in many different ways as well. It can express itself in thoughts. It can express itself in imagery. It can express itself in feelings. And all of the long history of hypnosis involved different ways of allowing the subconscious to express itself. Our conscious mind is fairly limited. We can't handle too much information. And the brain, the subconscious brain, filters and digests the inputs that we get and feeds it to our conscious brain in a way that we can understand. So hypnosis allows us to short circuit the system and to interact sometimes with the subconscious directly.
Yeah, it is amazing. What are your thoughts, maybe not for children, but in society at large, we're seeing people with PTSD and various diseases actually using microdosing drugs, in our case, let's say LSD, very, very small microdoses amounts, and they're seeing amazing results. I know Michael Pollan from the Bay Area, who's written all the books on health, wrote about it. We have lots of people writing about it today. Where do you stand as it relates to, high anxiety, PTSD, psychological disorders, which are totally debilitating for somebody to maybe take that kind of therapy?
So I'm not an expert in this, but I'll tell you my viewpoint is this. I think that psychedelics and certain drugs do the same function as hypnosis. They park the conscious mind.
That's what I thought.
And I think, for example, the hallucinations that can accompany psychedelic experience, I think come up from the subconscious and through the subconscious. And you become more aware of them because your conscious mind is not filtering them out, or they're not filtered out before it gets to the conscious mind. I have the belief that the subconscious mind can tap into realms beyond ourselves. Mm-hmm. And when we do use a psychedelic drug, you become more aware of those realms, which is why people have these amazing experiences and new perspectives following such an interaction. All that being said, I think if you're gifted at hypnosis, you can achieve many of those same results by without use of a drug.
Well, I'm glad to hear you say that, because I actually believe that there aren't many, a lot of people would be afraid to go down that path, and because of maybe the repercussions or after effects of the drugs and not knowing it. But to go in and get hypnosis, whether it's on your child or you, is a completely safe, logical way to approach this. And I can speak from experience, it works. It works in so many different wonderful ways. Now, you state that the physical and the mental health are deeply interwoven. You've said that. How do you determine when you will use hypnosis as well as more conventional methods, including drugs, to treat patients? Or is it the standard protocol in most of your cases to combine, let's say, a drug for something and hypnosis? So if this child happens to be on a drug, are we keeping him on the drug, or are we trying to actually get him off of him or her, off of the drug, and have hypnosis basically cure the condition?
So that's a complex question, because the answer will vary depending on the situation that the patient is dealing with. And this is why I think it's important to state here that whoever is doing hypnosis with you should either be an expert in treating the condition they're working on without use of hypnosis, or they're working in conjunction with, let's say, a physician who understands the condition well. Because you don't want to treat someone with hypnosis if a medication is better, and you don't want to treat somebody with a medication if hypnosis is better, but you have to be an expert to be able to guide that. I should back up just a moment. We've talked about, you've mentioned doing hypnosis on people. Hypnosis is done with people.
I love that.
All hypnosis is self-hypnosis.
Okay, I got it. Got it. Okay.
And just to we haven't talked really about misconception. I want to spend a moment talking about that. So people hear hypnosis, they think, oh, some magician is going to make me cluck like a chicken and some evildoer will control my mind.
Yeah.
And that's all fake.
Yeah.
That is not what hypnosis is.
No.
All hypnosis is self-hypnosis. The only one in control of your mind is yourself. Hypnosis can help you better control your mind, which is what we're talking about. In terms of your question about how do I decide whether medication or hypnosis is necessary, depends, again, on the medical condition. So for example, there's an entity called vocal cord dysfunction, in which the vocal cords shut off or close off when you're trying to breathe in. It's very hard to breathe.
Yeah, you had an example of a girl who was a runner
Correct.
that we're going to get to, actually. It's one of my questions. But you know, her case was extreme.
Correct. And well, what was extreme is what the physicians did to her was extreme, because they tried to cure her with medications. And for vocal cord dysfunction, which happens because you're stressing yourself out too much, medications don't work. And then they tried to cure her by taking out her tonsils. And then they wanted to inject her with Botox, the vocal cord Botox. And that's all so unnecessary, because for that kind of condition, using hypnosis to teach her how to relax was curative. In the case of a child with asthma, as an example, sometimes medications are very much needed to control the asthma, but teaching a child how to relax can also control the asthma, sometimes better than even the medication.
Mm-hmm.
In fact, there's a hypnotic technique involving imagining the very first time you had trouble breathing and teaching a younger version of yourself to not to panic at the time you couldn't breathe from the first asthma attack. And sometimes that makes all your symptoms go away. So if you can do that, then you can actually take away medications. In other cases, let's say somebody with cancer, they need their chemotherapy or they need the radiation therapy, but hypnosis can be very helpful in helping them cope with the discomfort of the illness or discomfort of medical procedures. So in that kind of patient, you'll want to use both medication and hypnosis. And finally, there are patients that you wouldn't want to use hypnosis for. Somebody who comes in with a headache and has never really been worked up by a physician should be seen by a physician first. Maybe they have a brain tumor. Using hypnosis there would be malpractice. It would be very bad, because you might delay the diagnosis being made and the patient could even do very badly. So that's why you need to know what you're doing when you're using hypnosis for medical issues.
Well, you know, look, the suggestive thoughts that a hypnotist, let's say, puts a patient under is extremely powerful, powerful enough to, as you said, mitigate some of these challenges associated with pulmonary conditions and other conditions. And I totally believe that. And I think that, you know, the follow-on treatment, if the hypnosis works, is a long practice. This is my personal commentary of meditation, because it works so well at calming the whole body that it would be good. Now, you list in the book clues that suggest a child's emotion may be related to their physical symptoms. Can you tell us what some of those signs are and what a patient or a parent might want to look for in their child as far as the list? You put a list in the book of those.
So a child who gets very emotional as a result of their symptoms suggests that their emotions may be impacting the symptom. A child whose emotions impact the symptoms, or they get upset and they get their symptom, that suggests emotions are at play. As symptoms that tend to stop when you fall asleep are more likely to have emotions involved. And then symptoms that don't get better with medications are quite likely to have emotions involved. I will tell you, the majority of medical practice involves dealing with symptoms that are the result of emotions. The majority. This is not some weird kids. And if you go to the emergency room, the people come in with chest pain and with headaches and stomach aches, the majority of those have psychologically driven symptoms. Of course, you have to make sure they're not having a heart attack, right? They're not having bleeding ulcer, but those are infrequent.
Yeah, no, I totally am in your lane. I agree with everything that you're saying, because the power of the mind over the physical body I speak from personal experience, having had long bouts with anxiety attacks. And those anxiety attacks, I couldn't determine how they were being triggered. But I went to Scripps, and this goes back into the 70s, right? I mean, let's see, it was the early 80s. I take that back. And they wired me up and put on the sensors, put it on my brain, and I could see on the screen what my body was actually doing neurologically. And I could see myself having one of these panic attacks. And I then started doing meditation. And the meditation for now 40 years, I've never had an anxiety attack again. But the anxiety attacks were real. You know, you feel like you're having a heart attack. You feel like you're claustrophobic. You feel like the world's coming in on you. There are all kinds of symptoms associated with that. Now, you talked about the vocal cord thing, and that's Kayla. This was this middle school student, an athlete who developed this perplexing crisis to almost every cross-country event, which was the vocal cord dysfunction. And I think you've already addressed it, so I'm going to kind of move on beyond that, a question. But you treated her with hypnosis, and it worked tremendously well because the story was fantastic.
Well, if I may tell you another story of another child with vocal cord dysfunction, and this story will tell you how much psychology can affect symptoms. This was a 12-year-old boy who developed vocal cord dysfunction, but unlike Kayla, who only developed her problem when she was exercising, he had it all the time, and he spoke very softly because his vocal cords were touching each other. And he had been through speech therapy and psychological therapy. He came to see me. I taught him hypnosis, which is teaching him how to imagine relaxing in a safe place, imagining all of his senses, and teaching him how to calm down. And typically that's enough to treat vocal cord dysfunction. In his case, it didn't make much of a difference. He still was having trouble breathing. So then I taught him how to interact with his subconscious. And there are many ways of doing that. A simple way is having the subconscious move fingers for you, one for yes, one for no, one for I don't want to say. And then you can ask questions. So talking to his subconscious said he knew why the boy was having trouble breathing, and he was willing to type with me. The subconscious can actually type, which is another way of interacting with the subconscious. And then you can have full conversations. And the story was that the year before I met him, this boy was so despondent, he almost committed suicide. He almost hung himself. And he didn't, obviously. But he couldn't believe how close he came, and he was feeling guilty about it. And the reason he had the vocal cord dysfunction is he was still guilty about almost having hung himself. When we talked through that, and I point out to him that this is a year later, he's overcome that, the vocal cord dysfunction stopped. His breathing became normal. But the next week, he developed blindness. He couldn't see. And the parents were quite panicky, but I brought him back in and I talked to his subconscious. Now, even though he was blind, he was able to see the typing. And the subconscious explained he made him blind so that he couldn't see hangers in his room and remember that he tried to hang himself. So we talked through that, and his blindness resolved. And the next week, he became deaf. Brought him back, talked to his subconscious. The subconscious said, well, he didn't want to hear things that will remind him of that he tried to hang himself. So we talked through that, and he could hear again. And the next week, he came in and he couldn't move his arms. Talked through that. And the reason was he didn't want to hang himself again, so he couldn't move his arms. We talked through that, and then he was able to move his arms, and then he was fine thereafter. It's been a couple of years. He's been fine. This case, which is not in the book, so you get a bonus here, illustrates how much psychology can affect symptoms, and sometimes how complex it is to unravel the symptoms. Most patients, fortunately, it's much simpler. 2/3 of my patients teach them to relax and they're much better. But sometimes they're quite complex, like this young man, and it takes a while to unravel.
You know, the state of the journey of a child from birth to adolescence is wrought with all kinds of challenges and so on. And I'm just wondering, because sometimes they say this is a call for attention. They're looking for attention psychologically, so it manifests in this ailment or whatever, so they can get the attention. I don't know what birth order. I'm not certain that that makes any difference one way or the other. Do you have a comment about this whole journey from being born to going into adolescence, trying to get attention because you're either competing against siblings or something occurred along the way where a father or mother just said you weren't enough, you were never enough? It seems to be an ongoing issue that I think it's a disease within society, right? I don't think it's that any of us, I should say that, not any of us, but a very small percentage of us, where we were just praised so much that we were always enough. So do you believe that some of that manifests as a result of that journey, and then it expresses itself in a disease where they can be noticed? I don't know.
I think that can be the case. I would say to you, any psychologically driven symptom, which is many, many symptoms, has a reason for that. There's some benefit to the patient, or the patient expressing themselves in some way. Okay. So in the case that we've discussed so far, the girl who was stressing herself out and with sports and couldn't breathe, the couldn't breathe was telling her, I'm worried about doing well in sports. The boy who couldn't breathe because he had almost hung himself is saying, I'm really having trouble dealing with the trauma of almost having hung myself. Right. But yes, there are children who develop symptoms because that's the only way they get attention. And sometimes it's not even selfish. Sometimes they draw attention onto themselves to get the attention away from their parents. I had a child once who came to me. I was the 5th medical center. He had headaches, chest pain, and stomach aches, and nobody could find a cause for these symptoms. When the last medical center sent him to me, said they knew I did hypnosis and they figured it was psychological, and I thought it was psychological as well because stress causes all those things: headaches, chest pain, and stomach aches. And I told the parents, hey, let me teach your child hypnosis. If I'm correct that these are all related to stress, he'll get much better. And the child, I could tell, was interested. The parents said, we're both university professors. We believe in the mind-body connection, but we're not going to let you teach our child to do hypnosis. And they left. And I'm thinking, why would parents who have gone to 5 different medical centers not want me to teach their child how to help himself get better? And I could think of a few reasons. One reason is they would feel foolish because they'd been looking for so long. Another reason might be that they were having trouble in their marriage. And by focusing on the child's illness, it helped them cope with their trouble. Right. In that kind of scenario, and I've seen that in other cases, if the child may not get better either, because the child needs to play that sick role within the family. So it can get actually quite complex.
So your counseling is not only with the patient, but it's with the parents of the patients as well, because you obviously are working with them along the way, correct?
Correct. So family members often play a role in the patient. If I may, one time I worked with an 85-year-old lady, and the only reason I was working with her is she had habit cough, a pulmonary problem that resolves with hypnosis. Habit cough is a cough without a physical cause, and it can last for years, as it had in hers. And she was referred to me by her pulmonologist and asked, can I please help her? So I said, sure. So I met with her and I taught her hypnosis, and her cough improved. But like many other physical symptoms, as we got to know each other, we found out her cough got worse when she became frustrated with her husband. And the husband had worked all his life, but he was retired, and she had worked all her life, and she wanted some help from him in the house, and he wouldn't give her the help. He wasn't used to doing that. And she was really aggravated with him. And that's when her cough would manifest itself. And I ended up sending them to marriage therapy at the age of 84.
At the age of 80 something. Well, look, a lot of marriages go a long time. Doesn't mean they're perfect. It just means that we've developed ways to tolerate, right? You state that nearly every aspect of medicine has an artistic component as well as a scientific one, but that it is rarely discussed because creativity and sensitivity are more difficult to observe and describe. Measure and replicate that pure science. if you would speak with us about the power of the words with empathy and creativity to help heal patients.
So all good physicians are careful about what they say, and they're aware that how they present information will affect the patient.
Yeah.
So for example, if I'm going to put you on a medication and I say, hey, let's try this medicine and see how it works. If it doesn't work, we'll try something else. That's going to get one result from the patient, as opposed to, hey, let's do this medication. It's helped many of my patients. I believe it's going to help you. It's going to get a different result.
Right.
This kind of approach is not discussed in medical schools.
Of course not.
And it's not discussed by pharmaceutical companies. And yet is vital in terms of getting the best results for your patients. And that's just a small example. So when you learn how to do hypnosis as a clinician, it sensitizes you how to talk to people. So for example, we will talk about when your stomach improves, then you can resume your life, as opposed to when your stomach stops hurting. Because when you say stops hurting, that the patient hears hurt, and that makes the stomach feel worse. So just simple words like that can make a big difference in how we talk to ourselves. Same kind of thing. When you say, I'm afraid I'm going to fail my test tomorrow, you're more apt to do poorly than if you say, I would like to do well on my test tomorrow.
Agreed.
And that's actually the first lesson when I meet a patient, I teach them about the power of words.
Well, this show is around personal development. And for years, I've done interviews with authors on, everything from affirmations to mantras to meditation to whatever it is. And all of these tools, all of these processes, all of these techniques are to reprogram the mind such that the mind is not, in this case, kind of controlling the outcome. In your case, you're getting to the subconscious mind, which is being reprogrammed, and I love it. Now, you're aware that hypnosis works best when the children you treat have buy-in for what you're doing. And we just talked about this because of the way you say it. You use exercises to get them to experience the power of the mind. One example in the book was applied kinesiology. I mean, at least that's what I assumed. You said lift up your arm, push your arm down, associated with being strong or weak. Can you explain how this works and the effects it has on your patients? Because it is the power of suggestion. You tell me I'm push against my arm. I've had that done by numerous doctors, but yeah, tell us.
So the demonstration we show is that the child puts out their arm, and I tell them to resist me. When they say to themselves, I'm weak, I'm weak, I'm weak, they become weak. When they say I'm strong, they remain strong. And when they say I'm not weak, they become weak as well. And then we discuss that the main word we use is what the mind focuses on. And then there's a corollary to that demonstration. I have them hold out their arm, and I say to them, you're weak, and they get weak. And I say to them, you're strong, and they become strong. And then we talk about how they take other people's input in, and that affects their strength as well. And therefore, they want to surround themselves with positive people. I will have the parent in the room for these demonstrations, because the parent needs to learn how to talk differently to their child. Instead of saying, stop yelling, the parent might say, stay calm or become calmer. And then finally, I teach the child, you can block this effect. I ask them, how do you think you can block when I say you're weak? How can you block me? They pretty quickly figure out they can tell themselves that they're strong, and then they stay strong. And then I tell them, have you ever dealt with any bullies who made you feel bad? And they'll say, yeah. And I said, who's responsible for your feeling bad? And some of them will say the bully, some people will say me, and ultimately, yeah, you're responsible because you let it in. If you don't want to, you can block it, and nobody can affect you without your permission. And that's the first day lesson, which is a really powerful lesson. You mentioned applied kinesiology. I want to say a little warning for the listeners. What I've learned with this arm strength demonstration is that my beliefs as the practitioner affects the arm's response, even when I'm not aware of it. My subconscious belief can affect arm response. And I think one of the reasons applied kinesiology does not have the best of reputations is because people are doing like testing for food allergies. And they say, oh, you must be allergic to this food because your arm went down. However, what they don't realize is that if, let's say, a practitioner thought there might be an allergic reaction, they can cause the arm to go down without even being aware they're doing it. I learned about this myself when I had a medical student stand behind me, and I was testing out whether patients get the arm gets strong or weak. What I expected is what the patient did, but it had nothing to do with what the patient was thinking. So I learned that's part of it. So to be careful when you use it.
Yeah, very much so. And but it is used a lot by chiropractors and other folks to test for allergies or to test for muscle weakness, or but it is being used. But I totally concur that the words you use are so powerful, and the way in which a physician who wears a white coat speaks with a patient because he speaks from authority can actually have either a positive or negative impact on the outcome of that patient as the way in which they address that patient's conditions. So the little simple changes in the words that you used in your example were so important. And you speak about identifying your patient's pain and state that this becomes complicated with the fact that the emotional and psychological factors hold sway over the way pain presents itself. What are some of the techniques that you use to identify the pain, and how does this differ from conventional medicine and the tools that we use to identify the patient's pain?
Well, the pain is subjective. So the patient's pain is defined by the patient. That's the first thing. So I'll ask the patient. And then the tools to deal with the pain involve teaching the patients to redirect their thinking, either by distract themselves from the pain, for example, by imagining being in a safe, comfortable place, or directly thinking about the pain and maybe imagining a pain or a comfort dial. I don't want to say pain dial, a comfort dial, that if you dial up, you're in more discomfort. If you dial down, you're in less discomfort, and the patients can actually modulate their pain. And before we move too far from the discussion about words, making a diagnosis can be harmful. Doctors make diagnoses because they're trying to figure out how to best treat you, and they can bill for the insurance company. But if you are told you have a certain diagnosis, some patients or many patients just take this to heart. This is what I have.
They claim it.
And they believe it can't be changed.
Yeah.
And that is so wrong. I fell into that same trap. One point, my doctor told me, you have familial hypercholesterolemia. You have high cholesterol. It's genetic. Great. Nothing I can do about it. Well, that's wrong. I learned later in life, after I lost a lot of weight, that my cholesterol became completely normal.
Mm-hmm.
So what I have is a familial tendency to high cholesterol, but that doesn't mean I can't do anything about it. And so too often doctors, by giving us a diagnosis, make us feel trapped into that diagnosis.
Well, epigenetics, look, you can walk around and decide you're going to believe what he says or not believe what he or she says. And in your case, because you're a physician, you get that you had the ability to rebuke that authority word about familial cholesterol conditions, And so I understand, because I came from a family with all kinds of things associated with cholesterol and heart disease and so on. But that doesn't mean it has to be you. So just because it was in the genetics, and it depends, a lot of people say, oh, it's genetics, it's genetics, it's genetics. No, you're an individual soul. You were born into this world the way you were born in, and your history plays an important role. How you eat, how you exercise, all those are factors we could talk about. Now, but you end your book, and this is my last question here, with Paul, your patient, having handwritten a poem that he disavowed knowledge of having written the poem. And it's nicely typed in your book, by the way. And you comment about was the problems are worked out in the subconscious, and then the answer is delivered into awareness. Can you tell the story and the awareness that you believe Paul came to as a result of this poem? Because it's like he said, well, I didn't write the poem, but in essence, he did.
Well, his subconscious did.
Yes.
And poetry is really interesting. Some people say they channel their poems.
Yeah.
They don't, the subconscious says it channels the poems. It says, I'm not writing it either. It comes from outside of me. Actually, a lot of great poets have talked about channeling poetry. So it's an interesting concept. Remember, I talked to you earlier about the idea that in our subconscious, we have ability to communicate perhaps with something outside of us. In Paul's case, the poem actually predicted his death. And we actually talked about it at some length. And he wanted to understand what it meant to him. And I helped interpret it. So the subconscious, maybe at some level, knew what was going to happen. Maybe I knew at some level he was going to die because I sent him to Make-A-Wish 4 months before his death. Make-A-Wish is an organization typically for terminally ill children, but at that time they also took in children who were at risk of death. And I argued he was at risk because he had bad milk allergy. They actually took him after a twist of their arm. He went to the NBA Finals of the Utah Jazz against the Chicago Bulls in 1998, which was his wish. So maybe I knew at some level that it's going to come to this. And maybe I knew at some level I'd write this book because Paul and I talked about that he was teaching me so much and that I would write a book about it. And this book is a fulfillment of that promise.
Well, it's a great way to kind of bring your book, bring closure to your book, I should say, because Paul did pass away, as you had mentioned. And the reality, though, is you can really see how you brought around the power of the subconscious mind. No matter what that was, that soul's journey had a start date and an end date, as all of ours do. And how you treat it in between is important. And I think what you're doing is so important for people to look for alternatives. Just because you're going to a pulmonologist for your child doesn't mean that you can't try something different. And what I'd encourage my listeners who are listening today to this is, at first, if you want, just go get the book. You can get it on Amazon. We'll put a link to it. Changing Children's Lives with Hypnosis. And Ran Anbar is our guest. And please go do that. And again, to learn more about how he treats patients and how you can get in touch with him, go to centerpointmedicine.com. We're going to put a link to that as well. And for the listeners who might be considering hypnosis for themselves or their children, what are some of the things that you would say, kind of wrapping up here, that would give an opportunity for us to kind of speak a little bit more about, say, if they have questions? I'm dubious about what it is that you do, and I really want to know more. What would you tell them other than getting the book?
Well, I have another website called centerpointhypnosis.com that talks more about hypnosis, what that is. I would encourage them to check out that website. They might also check out the website of the American Society of Clinical Hypnosis, ASCH.net, that has a lot of information about hypnosis. And I would tell them there's no downside as long as your child's interested. Because if they're not interested, nothing's going to happen. As long as the child's interested, there's only potential benefit. And if we have one more moment, if I can talk to you about the book cover briefly, I got a chance to help pick the book cover. And I went through hundreds of photographs of boys in boats on a lake, because that was where Paul used to imagine going to relax on a lake. And after the book cover was picked, several months later, I was looking at on Bing.com at images of kids on a lake, and came up a book cover in color version, and it said more photos like it, and it said where the photograph was taken. It was taken in Oneida Lake in New York, which was 18 miles from where Paul lived, and this is probably his lake that somehow, through Providence, I picked out of hundreds of other photographs.
It's a divine intervention there. You really did have that. Again, for my listeners, thanks for taking the time today to impart some of your wisdom about hypnosis, and in particular, hypnosis on children, and how you apply that. We'll put links to your website. We'll put links to the book. It's been pleasure having you as a guest on Inside Personal Growth. And please, everybody, if you have questions, go to his website, send an email, check it out. We'll put links to all of these. Thanks so much for being on.
Thank you so much for having me.